We did our clinical immersion mostly at Stanford Hospital. We were all over the hospital in different areas.
Our team created basically around 200 observations and 200 need statements. We actually all translated our observations to need statements on a shared Excel spreadsheet.
And within the online spreadsheet, what we did is we had one column of observations, and then in the next column we had a corresponding need statement. And sometimes there might be two need statements from a single observation, and other times it would just be sort of one-to-one.
A good need statement should have three components: a problem, a population, and an outcome. The problem is the issue you're trying to solve. The population is who you're actually trying to solve that issue in, so defining your target population. And then the outcome really achieves two things. It's the value proposition, and it's also the metric by which you're going to measure success.
So I was observing a procedure the other day, and I saw that the surgeon took about 15 minutes just to do one anastomosis. And I've heard that OR time is so expensive, it's about $60 a minute. So I thought it was a good need to have a way to complete vascular anastomoses faster in order to save time. So upon further review of this need statement, it became clear that vascular anastomoses really vary a lot from procedure to procedure. There are a lot of types of anastomoses, there are a lot of sizes of vessels, so we have to narrow this down to something a lot more specific to really be able to address the problem. We also need to define a population, potentially narrow this down to certain procedures we could use a solution for this need in. And we also need a better outcome. This saving time turned out to be, while sounding great in practice, not really that valuable to physicians during these procedures. Saving a few minutes of OR time is really not enough to really get a technology adopted.
We noticed a lot of patients coming in with kidney stones, so initially we came up with this need, a way to ease passage of kidney stones from within the ureter in order to facilitate passage of kidney stones less invasively. So again, this need statement initially sounded pretty good. Upon some review though, we realized that the outcome is actually the same outcome as the problem. So if you notice, the beginning of this is a way to ease passage of kidney stones, and the outcome is to facilitate passage of kidney stones. So even though it is technically an outcome, it's sort of a circular outcome. So we didn't end up using this need statement because it had a couple problems. One of the other needs we found in patients with end-stage renal disease who are on dialysis was a way to adjust the blood flow through an AV fistula. This need came about because some patients, once they have an AV fistula put in, were having extremely high blood flow, and you could, if you don't even need to measure it, you could just touch it and it would be like too much blood and you'd get some Steele syndrome. So we came up with this need. The problem is that there's a little bit of solution embedding here, which is that the problem was just that there's Steele syndrome going on in their arm, but the solution is to adjust the blood flow. So this need sort of already had a solution embedded.
Another need statement we had was a way to eliminate high-grade bladder cancer without cystectomy. Now this one is lacking both a problem and an outcome. So we saw that removing the bladder is very difficult for patients, but we didn't outline in the need statement why that's really a problem. Is it the bladder function that can't be replicated, or is it the complications of the procedure, or something else? We also don't have a measurable outcome that shows what benefit to patients we could really have with this by solving this need statement. So without a problem, without an outcome, we can't really come up with a solution to this need.